There are four levels of care when seeking therapeutic interventions for your child. The first and lowest level of care would be your traditional outpatient level of care, whether that's seeing a counselor or therapist once a week or once a month, whether that's seeing a psychologist or psychiatrist, or even a life coach, where they traditionally go in and see that professional once a week or once a month. A step above that would be intensive outpatient level of care. In an intensive outpatient level of care, you're going 3 to 4 times a week, group, individual, family therapy. This is your more, just as it's called, intensive outpatient. So you're not going once a week or once a month, you're going multiple times a week. She or he is getting that individual, group, and family therapeutic intervention. It's important to remember that if you are doing family therapy on any level of care, that if you want your child to be wholehearted and engaged, you need to be that as well as the parent, because they're only going to do as much as they see you doing. So if you're not real about it, they're definitely not going to be real about it as well. After intensive outpatient, a step above that would be partial hospitalization, or also known as PHP level of care. On a PHP level of care, that's when they're not yet in 24-hour care, but they're still getting that Monday through Friday, 9 to 5 therapy, group, individual, family. Typically, they're going to school as well, unless that particular partial hospitalization doesn't do school during the summer. They may have a summer activity program as well, but they're going Monday through Friday. They're going home in the evenings and on the weekends, so it's not quite a 24-hour level of care. A step above partial hospitalization would be residential level of care, also known as RTC. On an RTC level of care, that is a 24-hour level of care. Those individuals in and needing 24-hour level of care typically are a harm to themselves or others, but not quite needing acute care or that inpatient hospitalization. On a residential level of care, ours particularly at White Horse Ranch, they get about 45 therapeutic hours a week. That includes individual, group, family therapy, and then schooling as well, along with our equine therapy program of adopting a horse. On an acute care level, which is your highest level of care, would be acute care in the hospital. And that's typically a 3, 5, 7, 9, sometimes longer day stay, where they are an immediate harm to themselves or others, and they need that immediate intervention. And sometimes they have to go to acute care when waiting on a waiting list for a residential treatment program bed to open for them. If you know that your child needs an intervention in their world right now, go to your nearest mental health clinic, schedule an assessment, and see what the best level of care for them and what they're struggling with during this time is. Parenting a teenager is hard. There is no handbook for parenting. But if you want more info, like and subscribe to our YouTube channel, and we will definitely give you some more tips.